name is Eric Crawford. I'm from Maysville, Kentucky.
Senator West.
Representative Al Gentry.
My name is Jaime Montalvo, Executive Director of Kentuckians for Medicinal Marijuana.
Chairman Fisher, committee members, on behalf of all the veterans, the many medical experts, policy experts, and law enforcement that make up the Medical Cannabis Task Force who are gathered behind us, we want to say thank you. Thank you for allowing us to be here today to discuss what is the nation's gold standard in medical cannabis legislation, House Bill 166. House Bill 166 is a bipartisan piece of legislation that several Kentucky counties and cities have endorsed, and which have several House co-sponsors from east to west, some of which sit in this very committee. As you know, medical cannabis programs are currently active in 29 states and the District of Columbia, with Virginia and Tennessee on the verge of passing their own programs this year. This means nearly every state that touches our borders will have a medical cannabis program. This also means that Kentucky, once again, is being left behind. Why is Kentucky's House Bill 166 the gold standard legislation for medical cannabis? Simple. With over 60% of the nations having a successful medical cannabis program already in place, we have the ability of incorporating what is working best in those states and then apply those elements to the tightly regulated system we are proposing here today. More importantly, with the help of our Secretary of State, Allison Grimes, and veterans organizations around the state, we had 3 very successful task force meetings over the course of 6 months. Each meeting acted as a clearinghouse for new ideas on how this would work in our state and allowed us to make proper changes to the bill language. With doctors, nurses, healthcare organizations, law enforcement, regulatory administrators working alongside our veterans and patients, we were able to streamline, innovate, and customize what we believe is the best single model in the nation to provide better health care outcomes. Because in the end, this is what House Bill 166 is about, better health outcomes. This is not about marijuana or the unfounded, unscientific myths that surround the plant. This is about patients who have exhausted all their options and resources and now are begging us to pull our heads from the sand to help. Kentucky has a medical refugee crisis on its hands. As we speak, there are Kentuckians in our district that have uprooted from their families, places of work, to live in RVs or tiny apartments in legal medical cannabis states so they can have this critical health care option. There's not a member of this committee up here who doesn't have constituents. That's spreadsheet to prove it. They're on here. That does not have a constituent currently reaching out to us and begging that we pass House Bill 166. These are the people we go to church with, people we see in our grocery stores, and folks who voted us in office. Now I can tell you, they have had enough of that. We have had to study this more, or we need to wait on the federal government. Let me say, we need to continue studying medical marijuana. I agree 100%, no question. We need to continue to study the same way we continue to study seat belts, airbags, because no car maker is sitting around waiting for the final study to see if seat belts are a good idea. There are literally tens of thousands of American studies that show the clear and convincing evidence that medical cannabis is the best option to treat specific conditions outlined in House Bill 166. If you haven't read these studies, that's okay. The National Academy of Science has helped us out. They put together roughly 10,000 of these studies and came to the conclusion that medical cannabis is perfect for treating patients with MS, chronic pain, folks dealing with effects of chemotherapy, and so much more. The American Journal of Medicine shows us that in every state that has a medical cannabis program, they see a 25% reduction in opioid death and abuse. Folks, it's 25% reduction in opioid deaths and abuse. If the federal government's view on cannabis is holding you up, well, it didn't hold us up when we passed Senate Bill 50 to legalize hemp. The follow Every member of this committee that was around in 2014 voted in favor of that project, and it flew in the face of our federal government's position on hemp. And we are better off now because you did. This is a 10th Amendment issue, folks. I came up here to help folks, and that's what I did as a county magistrate, and that's what I'm doing here as a state representative. And I don't care if it's a small group of wealthy, bought and paid for special interest groups say we can't do this, they're wrong. House Bill 166 will do 3 major things if we pass it as currently written. Number 1, it will create jobs. It will infuse revenue into our state. House Bill 166 is considered the gold standard because no other medical cannabis program provides more money to ensure it's properly regulated and gives more money back to our local law enforcement officials. Number 2, It will help with the opioid crisis like no other current program can. Not only will we see a 25% drop in opioid abuse and deaths, but we will also see over 1,800 fewer painkiller prescriptions a year. Number 3, it will stop the injustice of a mother who has to break her current law to stop her daughter's seizures and give them a quality of life they deserve.
Let me remind our guests that we are in a hearing, we're not in a rally. So let's keep it calm. Thank you.
Sure. It will allow our grannies with fibromyalgia to return back to church. It will allow folks in the battle of cancer a better relief than narcotics they are forced to use. It will stop the injustice of the combat veteran who comes back to Kentucky who fought for our freedom, sometimes through multiple deployments, but now has to fight us here in Frankfort, just so they can win the other war they are dealing with, PTSD. I'd like to enter a record letter from our Secretary of State showing that Kentucky's very own Medal of Honor recipient, Dakota Meyer, who urges this respective body to pass House Bill 166 as written. Countless veterans, organizations, and individuals are here today and watching us on TV. Mr. Chairman, for them, next year is not an option. I encourage this committee to share their courage, the courage of our neighboring states to give our people better health outcomes with safe, tightly regulated access to medical cannabis. The time is now. Let's get this done.
Thank you so much, Mr. Chairman, and members of this committee. Thank you for letting me have the opportunity to speak on this measure. Today I'm here to represent the permanently, partially disabled. We learned in House Bill 2 that they are those that have permanent disabilities, but they go back to work. Okay? These are permanent partial disability workers that are not on Social Security, are self-sustaining, they raise families, they get up every day to compete in the workforce physically short-handed, pardon the pun. We have to work differently, harder and smarter, and offer something more just to achieve the same level of productivity. It takes a special mental approach to life, an incredible perseverance to accomplish this. I personally learned these traits myself attending disabled golf events across the country. We consistently inspire and touch those around us, uplifting everyone else's productivity that notice us, not because of what we do, but because how we do it, despite our physical barriers. Many of this same group have something else in common, chronic pain. And today, I'm speaking specifically of chronic nerve pain, or phantom pain, as is often called. This is common in amputations and spinal cord injuries like brachial plexus. As I traveled across the country with my PPD brothers and sisters on these golf circuits in the late 90s and early 2000s, many of us had these pill jars full of pills, painkillers, prescribed opioids, FDA-approved medication that was legally given to us like candy by our medical community and marketed to us as the wonder drug. It helped our bodies endure the rigors of golf tournaments, to go to work, and to be able to come home after work and throw a ball in the yard with your child. What we didn't know, and we're soon to find out, that these so-called wonder drugs would ravage and sometimes destroy our lives. I personally saw the lives of several of our athletes be destroyed through opioid addiction. Divorces, treatment centers, incarceration, and yes, in some cases, even death were not uncommon. And on the positive side, I personally witnessed many success stories from our athletes that were able to somehow escape the grips of this addiction and come back again to lead productive lives. How did they do this? Through cannabis. Real people from different states. And I'd like to be able to share their stories with you today, but once again, we're short on time. What they all told me was that it wasn't necessarily that the cannabis did a better job addressing the specific pain, but that it created far less negative side effects. In short, for them, it was a safer, less intrusive, more effective option. There's a reason access to medical cannabis is growing across this country. It simply works for certain people. The last thing I want to say today is that, as you know, last month Representative Bentley forwarded a resolution in the House asking the FDA to research this issue. Representative Sims and I both voted for this measure. Why wouldn't we? Everybody wants additional research. It's always helpful. However, I strongly oppose anyone that feels we should wait on the FDA before we advance House Bill 166. I sit here today and tell you that I don't need to wait around for some study, which may never come, to tell me whether or not this product can be a safer option for certain people. I've seen it personally. I know it is. Sometimes you just have to use common sense. This is not a new product. Legalized medical cannabis has been around for over 20 years. And you know how many overdose deaths have been officially attributed to it since then? I'll give you a hint. It's less than the number of hands I have. Do you know how many overdose deaths will have occurred during this meeting from FDA-approved prescription medication? I don't know the answer to that, but I can guarantee you this. It's more than all of our hands in this room combined. Think about that for a minute. Do the right thing. Give the people what they want and allow certain suffering Kentuckians access to a product that is known to be safer and more effective for them. And work with us to help us ensure this industry is regulated and administered better than any other. Thank you very much for your time today.
Thank you, Mr. Chairman, members of the committee, for having me over. I'm here today because I believe it's time for medical marijuana to move forward in Kentucky. I would like to see this conversation move forward, and so much so that I've filed a companion bill to House Bill 166 and the Senate Bill 118. Another reason I'm here is to support our friend Representative Sims. Representative Sims' district is within my Senate district, 27th district. So he's my constituent, but I also have another couple of constituents here, Mr. Eric Crawford and Michelle Crawford, his wife. And they started bugging me a few years ago on this issue when I got here. And as soon as I walked in the door, Senator West, can you file this bill for us? And I told them then, my first bill in the Senate will not be a medical marijuana bill. That was 3 years ago. And the product they had 3 years ago was completely different. And it's been really a true lesson in democracy, as you would say. They went back, they've done their homework. Eric and Michelle, along with Jaime Montalvo, have done a great job, along with many others, and they put together a good product. They've taken, as Kentucky, as is normal in Kentucky, we're the last to do many things. So with that comes the positive aspect that you can look what works best in other states. They've taken Massachusetts, they've taken other states, they've taken some of the data stuff from Colorado, and they've crafted this bill. And I think it's a good framework. Now, we can argue about whether or not it's a good bill. As with any complex issue like this, there are going to be changes, and will need to be changes. I filed this bill because I do think it is a good framework. It is a good start. It is something that we could build upon. And personally, I just felt that it was time. I believe in liberty, freedom, in rights of the individual, and not always going along with the federal government on everything they tell us to do. Representative Simmons makes a good point. If we want to wait on the federal government, we shouldn't have passed hemp legislation. But I do understand the other side of the equation. I understand the law and order aspect of this, but I'm ready for the debate. I'm ready. I think the state of Kentucky needs to have this debate, and I'm here to support my constituents. Thank you.
Thank you, Mr. Chairman and members of the committee, for having us here today. First, I'd like to explain what House Bill 166 is not about. House Bill 166 is not about legalization of marijuana. House Bill 166 is not about a party. It's not about having fun. This is about sick patients, qualifying patients, having safe access to a plant created by our Creator. I come here before you not as a marijuana activist, but as a former first responder in one of the busiest emergency rooms here in Kentucky. I worked there for nearly a decade, and never once did I take care of a patient who died or overdosed from marijuana. I took care of many patients who passed away or had traumatic injuries, cardiac arrest, pulmonary arrest, even some that we used narcotics on to help them ease the pain and pass on to another life. But again, I repeat, we never had one patient in this emergency room for nearly 10 years seeing 300 patients a day for marijuana. So I moved forward to discuss, and I provided a packet there just to briefly touch on the study that Representative Sims brought up. It's the National Academy of Science. They studied 24,000 studies. They narrowed it down to 10,000 studies. From those 10,000 studies, they made 100 conclusions. Out of those 100 conclusions, they had 3 solid conclusions with which were irrefutable. It was helpful in the treatment of chronic pain, like Eric Crawford suffers from. It was useful in the treatment of nausea and vomiting, like our friend Fran, who is a RN who's suffering from 4 types of cancer, who was unable to attend today because she was far too sick. And it was also helpful for multiple sclerosis patients like myself. So moving forward to the second study that Representative Sims brought up, it's also in your packet. I provided a chart, which showed a reduction in opioid prescriptions of nearly 11%. There is no other program that a state can implement that will reduce the actual prescribing patterns of our physicians to 11% less opioids. As Representative Sims said, that is 1,800 prescribing units per physician. Now moving on to the third study that he brought up was the JAMA study. That JAMA study is also provided in your packet. They found nearly 25% reduction in overdose cases in states with medical marijuana. That's from 1996 to 2013. Now, in that study, in that chart, it also talks about state-approved tightening of pain prescribing from pain management physicians. They stated in that study that decreased prescribing by 8%. 8% compared to the 25% in medical cannabis states. So with that said, I'd like to move forward to specifics of the bill if we have time, Mr. Chairman.
Certainly, please
Okay.
proceed.
So, in particular, this bill does not make it readily accessible for everyone to possess cannabis or to gain access. You have to be a qualifying patient. It gives these patients the choice, the freedom, or the liberty to try cannabis. So this bill would create the Department of Medical Cannabis Administration under the Public Protection Cabinet. This department would have to deal with public safety, administrative regulations, licensing of patients and caregivers, the licensing of cannabis businesses, and enforcing the law. Now, by passing this bill, it doesn't automatically legalize the sale in your local area. What it does is it allows your locality to opt into the program, just like with alcohol. And I believe that's a model that Kentucky's used to and has been dealing with for many decades. So the city or the counties will vote on bringing the licensing of the industry into their localities. If they vote to bring in the licensing, they then bring profit sharing to that locality. That profit sharing is 20% of the revenue from the taxes and the licensing. That 20% is to be used for the hiring of new drug recognition experts. That's police officer jobs. That 20% is also to be used for the hiring or the enforcement of the medical marijuana law in your local area. Again, that's more law enforcement jobs. It also provides the building of 6 different licenses, which are divided up across the state by the area development districts. So those area development districts, again, will vote in your county or city to bring in these licenses. The licenses being brought into your locality will be cultivator licenses who grow cannabis, the producers who make a finished raw product, a processor who takes that finished raw product and makes something out of it, like a tincture or a salve, something like that. They make a cannabis product. Those products are then distributed by somebody who has a license, which is a distributor license. That distributor takes that product to a safety facility. That safety facility is an independent third party. That third party checks those cannabis products for quality. That is for cannabinoid content, toxic molds, heavy metals, things that can poison patients who are actually already immunocompromised. So after that product is tested, it then goes to that compassion center, what's more known as a dispensary. That dispensary has to only allow licensed patients or their caregivers into that building. Okay. So I'll move it right along. It creates a 10% excise tax. Patients must have a qualifying condition, a qualifying practitioner. They have to get a certificate qualifying them as a patient, and it needs to be approved by that department. The rules and regulations. There are not to be any advertising, whether it's radio, TV, or billboard. There is no public consumption of any sort, so that smoking is not allowed. There is, again, DUIs and DWIs we curb by hiring new drug recognition experts. Practitioners cannot refer patients to a compassion center, and compassion center cannot provide access to a physician. Therefore, we curb the pill mill epidemic. Any product being taken orally by a patient has to be no more than 10 milligrams, has to be stamped with a state-approved symbol. It has to be non-reminiscent of an item that a child would recognize, like a gummy bear or a gummy worm. It has to be sold in a child-proof packaging, so it's hard to get into, just like our pills. And it's sold in opaque containers, so that you can't see through it. Again, we're looking at this from a public safety perspective. That is all the rules and regulations that I have. I tried to break down 32 pages down to 2. So it's
Appreciate it.
pretty difficult.
Thank you.
Yes, sir.
Any members have questions for this panel? Representative Watkins.
Thank you, Mr. Chairman. Thank you for the presentation. I just wasn't clear on the local vote. Is that the local commission or fiscal court, or is it the voters in a referendum?
Sure. That's a great question, and it can be your local county or city. Now, again, it can be licensed at the local city or county, just like alcohol. Now, if for some reason the locality chooses not to license, the citizens have the right to gather signatures on a general election year. They have to gather 5% of the signatures. That is 2 years after implementation.
So the original vote would be by the city commission or
Yes.
the fiscal court?
Yes,
okay.
sir.
Thank you, Mr. Chairman.
Representative Moser.
Thank you, Mr. Chair. Thank you for your testimony, and I do appreciate your thoughtful approach to all of this. We've had some conversations about this in the past. I have a lot of questions, but I will limit my questions to just a couple. How do Kentucky physicians feel about this legislation being squarely placed in the middle of this?
Do you mind if I answer this? Well, we've talked to many physicians across the state, one of them sitting right here in this audience. There are many physicians who are ready to certify patients for cannabis. I have 7, Eric has 8. I know that there are many others in this room who are willing to certify patients. What's important is that physicians do not give a prescription for cannabis, they actually give a certification. It's worked in 29 other states. There are over 2 million patients registered as medical cannabis patients across this country. 63% of the population are in a medical cannabis state.
So how many patients do you anticipate, do you have an idea of how many patients this will open up to?
Well, based off of chronic pain alone, which is what most, about 93% of the patients in most states qualify for, will be about 100 to 150,000 patients here in the state.
Okay. And so we have 15 doctors so far who are willing to serve that population.
Well, that's 15 doctors from 2 patients.
Okay. All right, if I may, one more.
Certainly.
So does this legislation put a physician's DEA license at risk since the DEA opposes this?
That's a great question, and I appreciate you asking that. Actually, this law protects physicians from the DEA. Actually, there was a law that was passed in 2014 which tried to make CBD oil legal for patients through research schools like U of L or UK, and it requested physicians to write a prescription and the hospitals to dispense. And that law actually hasn't functioned just because of that reason. So to go back to what you were saying, since 1996 there has not been a physician that has been reprimanded by the board of the state or the DEA for recommending medical cannabis.
So they're recommending, not prescribing, and that's
Correct.
how you get around that?
Yes, ma'am.
Gotcha. Okay.
Thank you.
Representative Nemus.
Thank you, Mr. Chairman. I want to thank you, Representative Sims, Senator, for coming and bringing this House Bill 166 in front of us. I wanted to note before I ask my question that I've never used this stuff before, disrespected kind of people who do, and was very much against it. I met with hundreds of constituents. I've read a number of studies, some from Israel that my friend in the back has sent to me, one that was provided from Cato on Friday, and the reduction from the opioids has changed my opinion on this. So I now favor moving toward medical marijuana in Kentucky. However, I want to make sure we're going the right way. And so I've got a particular question about 166, and Representative Sims, I'd like to go through the whole bill with you. Not now, obviously, but my question right now is the debilitating medical conditions. Who came up with those? It seems to me that irritable bowel syndrome, movement disorder, those kinds of things can be almost everybody. And so while I now support medical marijuana, I don't support recreational. So I want to make sure we can hold that line. And so help me understand why we have these particular conditions, and that doesn't just give the whole thing up.
These were the conditions, and you guys have this sheet here. We marked through some of these that we crossed out in other states that were qualifying conditions that we came and put in House Bill 166. And we're still open to working with these and adjusting this bill to make it right.
So did they come up with the Kentucky Medical Association, or you looked at other states?
Other states.
Thank you, Mr. Chairman.
Thank you, and thanks to all members of the panel. Representative Hatton has a question. Sorry.
If we have time, Mr. Chairman.
About 1 minute.
Okay. Talk to me about job creation.
Job creation. Well, we've divvied up the licenses by the 15 area development districts. There are 6 licenses per area development districts if the localities choose to have it. Each one of those licenses brings anywhere from 10 to 15 jobs, possibly up to 25 jobs for different licenses. So each individual business, again, can bring potentially up to 25 employees in each area across the state. So how many thousands of jobs could that be? It all depends really on the localities and how apt they are to actually having the licenses in their local area.
Thank you very much for your enlightening discussion. It's about, was it 3:45? So it's almost time to go over there. So we thank you all. We'll resume this discussion at a future date.
Thank you, Chairman.
Thank you, committee members, for your time. We appreciate it.
Stayed on the whole time. He did.